We have a great session for you, sponsored by Takeda, Getting to Know Short Bowel Syndrome and GATTEX. Please welcome to the stage Erin from Takeda, and she'll kick us off.
Thank you, Tracy, and thank you, Oley, for having us here today. I'm very pleased to be welcoming to the stage our two speakers for the Takeda and GATTEX brand. So welcome to Getting to Know Short Bowel Syndrome and GATTEX. We'll hear from a doctor and SBS expert first. Then we'll welcome our GATTEX patient ambassador to the stage to share her story. And then we'll have time for some Q&A. So with that, I will introduce Dr. Michalek. She is Associate Professor of Clinical Medicine from 2009 to 2024 at Albany Medical Center in Albany, New York. Dr. Michalek is an internal medicine physician with specialty training in clinical nutrition. She's a specialist in short bowel syndrome who has managed over 200 patients with SBS. This includes managing parenteral support, including TPN, IV hydration, as well as nutrition and medication management for symptom control and optimizing absorption. So we're really so grateful to have her expertise here. And with that, I'll hand it over.
Thank you, Erin. So welcome, everybody, to the GATTEX Patient Ambassador Speaker Program. So you're going to meet a patient, so you can ask some questions of her as well. We're happy to have everybody with us today. This is an important step in your journey with short bowel syndrome. So my name is Ann Michalek, and I'm here for Takeda. I'm being paid by Takeda to be here to speak with you. So we'll start out by just kind of reviewing what is GATTEX. So GATTEX is the brand name, generic name is teduglutide for injection. It's a prescription medication used in treatment of short bowel syndrome. Boy, I'm having trouble seeing these. Thank you. For adults and for children who are 1 year of age or older with short bowel syndrome who need additional nutrition or fluids from IV. And it's not known if GATTEX is safe to use in children who are under 1 year of age. The most important information about GATTEX is that it can cause some serious side effects that you should be aware of. And I'm going to talk about these a little bit more in detail as we go forward. Some of the most important things that you need to think about are GATTEX can make abnormal cells grow faster. Its job is to actually make your gut cells grow more. So if you have abnormal cells, they may grow faster. It can cause polyps in the colon or large intestine. The colon is the large intestine. It can cause blockages of the bowel, or also known as intestines. And it can cause swelling in the gallbladder or inflammation in the gallbladder or pancreas. And finally, it can potentially cause fluid overload. So fluid management is really one of the most important things that we do when we're using GATTEX. So today's program, we're going to do an overview of short bowel syndrome. We're going to introduce GATTEX. I need the bigger, did somebody just change that? Thanks. I'm going to introduce you to GATTEX and go over some of the clinical studies that led to the approval for GATTEX to be used clinically. And then I'm going to talk about Takeda's patient support and other resources, many of which you already know because you're already here with Oley. Then I'm going to introduce Misha, who's a patient on Gattex, and she's going to talk about her experience, and then we'll have some questions and answers. So we'll start with the overview of short bowel syndrome. You probably all know this better than I. It's a very serious chronic malabsorption disorder. It occurs most of the time when large sections of the bowel have been removed or resected, and the rest of the intestine isn't able to absorb enough nutrients, fluid, and electrolytes from what you're eating and drinking. So this results in what we call malabsorption, which can lead to malnutrition, dehydration, electrolyte imbalances, and severe diarrhea or ostomy, high ostomy outputs if you have an ostomy. There are multiple factors which go into making the diagnosis of short bowel syndrome, and it's not just based on your length of bowel, but also on the function of your remaining bowels. So there's lots of variability between patients, and no two patients are the same. Everybody's different. So after you have a surgery, your body almost immediately, your intestine will start to what we call hypertrophy or grow. So the remaining intestine tries to grow more cells to see if it can adapt and start absorbing more fluid, nutrients, and electrolytes. And sometimes that's enough. It may take a little while, but you may need some IV support for a short period of time and then be able to wean. But sometimes it's not enough, and you're just left with an inability to maintain your nutrition and hydration for a long term. And if the intestine isn't able to do that, then you become dependent on parenteral support. Parenteral meaning IV, coming through your IV, and that can be fluid and electrolytes, or it can be TPN. So many people with short bowel syndrome require parenteral support. Not everybody, but many people do. Parenteral support, again, is any kind of IV support that you require, and it can include protein, carbohydrate, fat, so your nutrients, as well as vitamins and minerals, the micronutrients, and fluid electrolytes. The amount of support that you may need will vary among patients depending on what the function of your bowel that's remaining, as well as the length and what part of your bowel is remaining. So somebody may need 1 liter 3 days a week, somebody may need 2 liters 5 days a week, or you may need 5 liters 7 days a week, depending on how much you're losing on a daily basis. So our treatment goals for people with short bowel syndrome are, first of all, to maintain essential nutrition and hydration. That's our initial goal, is let's replace what's being lost, let's meet the needs that the gut is not able to meet. And then we want to help the intestine to adapt to see if we can optimize what the bowel is able to do and improve your innate or autologous absorption, what your bowel's doing. And then we want to try and reduce or diminish how much fluid you need, so controlling diarrhea, and try and keep you using as little as you need so that you have as much free time as you can get. And then focus on improving quality of life and supporting healthy work and sleep and social activities. So I'm going to talk about GLP-2, which is glucagon-like peptide 2. This is a hormone that's made in the intestine, usually in the distal or more lower part of the intestine, so the end of the small bowel or the ileum, and in the colon. There's specialized cells, and you can see them labeled there with the L. They're called L cells, and they make glucagon-like peptide 2. Glucagon-like peptide 2 functions to increase the thickness of the lining of the intestine. and it increases the height of the villi. Villi are little tiny finger-like projections that stick up into the intestine. And if you think of them as fingers, each one of those fingers is covered with absorptive cells. So the longer those fingers are, the more absorptive cells that you have. So if you can increase the length of those villi, you have more ability to absorb. Just think of the lining of your intestine like velvet or like a Berber carpet. It has all these little bumps. And the surface of each one of those is working to absorb for you. So when the GLP-2 levels go up, you have more absorptive capacity, increasing the height of the villi. And that overall increases the surface area of your intestines, so more surface for absorption. But when you have a resection of your intestine and you've lost parts of the colon or the lower part of the ileum, you lose the number of L cells or decrease the number of L cells, so your production of GLP-2 is lower, and so you don't have as much stimulus to the gut to maintain that lining, the lushness of the lining, and the ability to absorb. Patients with short bowel often have lower levels of GLP-2. So what is Gattex? Okay. So like I said earlier, Gattex is a subcutaneous injection by prescription for adults and children 1 year of age or older with short bowel syndrome who need additional IV support or TPN. And it's not known if it's safe in children under 1 year. It hasn't been tested. The most important information, and this is what I'm going to go over now, is these 5 different potential safety concerns: making abnormal cells grow faster, polyps in the colon, blockage of the intestine, inflammation of the gallbladder or pancreas. So first, making abnormal cells grow faster. So Gattex is designed to increase the growth of your intestinal lining, your intestinal cells, so it can make abnormal cells that are already in your body grow faster. There's an increased risk that abnormal cells could become cancer. If you get cancer of the bowel, the liver, the gallbladder, the pancreas while using Gattex, your healthcare provider should stop Gattex. If you get other types of cancers, it's an individual decision between you and your healthcare provider as to whether you want to continue or not, because Gattex is predominantly focused on intestinal cells. Polyp growth in the colon was seen in the trials, and I'm going to talk about the trials in a little bit. Polyps are growths on the inside of the colon. Your healthcare provider will have your colon checked for polyps before you start Gattex. So you'll have a colonoscopy 6 months before starting Gattex and have any polyps removed. For children and adolescents, they're checked for blood in the stool as an indicator of polyps before they start Gattex. To continue on Gattex, your healthcare provider should have your colon checked at 1 year, again for new polyps, after you've used Gattex for 1 year. If no polyps are found, then your colon should be checked for polyps as needed, but no less than every 5 years. If cancer is found in a polyp, you should stop Gattex. So blockage of the bowel or intestine, the bowel blockage, many of you may have experienced these, prevents food or fluid and gas from moving through the bowel in the normal way. It can present with trouble having a bowel movement or passing gas, pain in your abdomen or stomach area, distension or swelling of your abdomen, nausea, vomiting, or blockage of your stoma if you have an ostomy. if a blockage is found, your healthcare provider may temporarily stop Gattex. And when we see the lining of the intestine getting thicker, if you have an area that's narrowed or strictured, that can potentially make that opening a bit smaller, and that may be what's contributing. If you temporarily stop the Gattex, that swelling will go away and it should open up again. And you may actually even be able to go back on Gattex. Patients have done so after a blockage and been fine. But that's a decision that you make with your own healthcare provider. So swelling or inflammation of the gallbladder or pancreas. So your healthcare provider will check levels of blood levels for your gallbladder and pancreas within 6 months before you start Gattex, and these should be rechecked every 6 months while you continue on Gattex. So you need blood tests every 6 months to monitor your pancreas and your gallbladder. Now, if the levels are up slightly and you're not having symptoms, you and your healthcare provider may decide to continue. If you have any signs of pancreatic or liver damage or injury, which might present as pain in the stomach area or tenderness, chills, fever, change in your stool color or consistency, nausea, vomiting, darkening of your urine or yellowing of your skin or your eyes, then you need to tell your healthcare provider right away, and Gattex will be temporarily at least held and possibly permanently, depending upon what you decide together with your doctor. So this is a schematic of the protein that is Gattex. So that orange glycine there is a substitution for alanine, which is in the native GLP-2 that your body makes. So Gattex is like GLP-2, just changed a little bit, and that makes it stay in your body for a little bit longer. It's not broken down quite as quickly. The native GLP-2 is turned over very quickly, so in order to make it useful medically, we had to somehow modify it to slow it down so it stayed in your system for a little bit longer. So Gattex has been proven to help the bowel that you have remaining absorb more fluid. So the first study that was done was basically an efficacy trial. Everybody took Gattex. There were 17 adults in this trial. They all knew they were getting Gattex. Doctors all knew they were getting Gattex. They tried 3 different doses. And the injections were administered under the skin. That's how it's dosed, with a subcutaneous injection. All of the doses studied, the 2 bigger doses, except for the lowest dose, which was 0.03 milligrams per kilogram, weight-based, daily dose, led to improved absorption of fluid by the intestine by 752 milliliters to a liter every day, less diarrhea. And when they looked at the surface of the intestine, there was actually improvement in growth in the villi and the surface area. So now I'm going to review the clinical trials that led to the approval of Gattex for clinical use. The first is the STEPS trial. This was a 6-month study, and patients were divided into 2 groups. Half of them got Gattex, and the other half got an injection that didn't have any medication in it, so they got a placebo. And they compared those 2 groups over a 6-month period, and at weeks 20 and 24, the goal was to see if we could reduce the amount of fluid that the patients were needing in their parenteral support by at least 20%. At the end of that trial, and I'm going to go into the results of that trial. At the end of that trial, the patients who were in both groups were offered to continue for another 24 months. They all got Gattex in this study. Even the placebo group, and as well as the Gattex group, continued on. And there were an additional 12 patients who had been sort of prepared and ready to go for the STEP study, but they closed out the enrollment before they were able to enroll. And so they were asked if they wanted to participate in the STEPs too. So we'll talk about the outcome. So this is STEPS, 6-month clinical trial, 86 patients, so 43 in each group. 43 got Gattex, 43 got placebo, and they were compared to see how much fluid reduction was able to be accomplished while still maintaining their hydration and their electrolyte balance. And the study also evaluated safety. And then STEPS 2 is an additional 24 months. So there were 88 patients in this branch of the study. So 37 of the Gattex patients from STEPS continued on. 39 placebo patients went on to Gattex in STEPS 2, and then the 12 new patients that had been optimized and were stabilized were also there, so a total of 88 patients. All the patients got Gattex on a daily basis, and they all knew that they were getting Gattex. So in these clinical studies, Gattex was proven to help patients with short bowel syndrome that were on parenteral support. Gattex reduced the weekly volume of parenteral support, and we'll go into the details of that. It reduced the time that patients needed to be on their IV support, so they got some days off. And over time, some patients were actually able to achieve what we call enteral autonomy. In other words, they didn't need any parenteral support anymore. They were able to come off. Not everybody, but some patients. We'll talk about it. So at the 6-month trial, and this STEP's on the left-hand side of the screen, you'll see that 63% of the patients on Gattex were able to reduce their volume, their weekly volume, by at least 20%. And incidentally, 30% of the patients that received placebo were also able to reduce their volume by 20%, but twice as many patients on Gattex over that 6-month period of time. At 30 months, so the group that was on Gattex for the first 6 months and then an additional 24 months they were on for 30 months, 93% of them were able to reduce their volume by 20%. So it took longer, but 93% of patients were able to reduce their infusion volume. And in terms of time on TPN, at 6 months, 54% of the Gattex patients had at least 1 day off a week. And 23% of the patients on placebo were off 1 day a week as well. At 30 months, 60% of the patients were off at least 3 days a week. So this is a slow process, gradually happens, but the bowel's growing and it's working better and better and better over time. And some patients gained complete freedom from their parenteral support. So of 30 patients who made it to 30 months, 10 of them no longer needed any of their IV infusion. So a 1 out of 3 chance of weaning completely from your IV support. So, and again, just a reminder, it takes time for this to happen. Some people were able to reduce their volume after 1 month of treatment with Gattex, but for others, it took 12 months before they were able to bring their volume down at all. So depending on how much bowel you have, what bowel you have, how good your bowel's working, et cetera, and its response to the treatment, it may take a longer period of time. So don't give up if you're not seeing, you try Gattex and you're 2 months in and you're like, I haven't noticed anything. You may be one of those people that takes 12 months before you're able to start coming down. But at 30 months, you have a pretty good shot at being off at least one day. So common side effects that you should be aware of, these are side effects that occurred in at least 10% of patients. Abdominal pain, nausea, upper respiratory tract infections, abdominal distension, injection site reactions, vomiting, fluid overload, and I'll talk about that in a minute, and hypersensitivity or allergic reactions to the injections. So if you have any of these, tell your healthcare provider. They may decrease over time because your bowel is growing and changing, and so you may notice it more in the beginning and adapt to it a bit, but these are the things that you should be watching for. So now these are the other points that we talked about early. Fluid overload. So your healthcare provider will be checking you for too much fluid in your body. If your intestine starts to absorb more fluid and you're still getting the same volume through your IV, we might overshoot, right? So too much fluid can lead to heart failure, especially if you have a history of heart problems. So always tell your healthcare provider if you start to see swelling in your feet or ankles, if you seem to be gaining weight quickly, which is more likely to be fluid weight if it comes on fast, or if you get short of breath. That can be a sign of too much fluid in your lungs. So the most common side effects of Gattex in adults, again, are stomach area pain or swelling, nausea, cold or flu symptoms, skin reactions at the injection sites, vomiting, swelling in your hands or feet, again, that's fluid, allergic reactions, and the side effects of Gattex in children and adolescents were found to be similar to those seen in adults. So always keep an eye out for those and make sure you tell your healthcare provider if you have any side effects or anything that bothers you while you're on the medication, make sure you discuss it. So what should we discuss with your healthcare provider as you're thinking about maybe starting Gattex? Of course, review all your medical conditions, which your doctors probably are aware of if they're caring for you. If you've had cancer or a history of cancer, if you've had polyps before anywhere in your bowel, in the colon, intestine, rectum, if you have heart problems, so your doctor's aware, if you have high blood pressure, any history of problems with your gallbladder, pancreas, or kidneys. If you're planning to become pregnant or are pregnant, it's not known if Gattex will harm unborn baby. So tell your healthcare provider immediately if you become pregnant and stop the medication. Also breastfeeding, or if you plan to breastfeed, it's not known if Gattex passes into the breast milk. So you should not breastfeed during treatment with Gattex. And again, talk to your healthcare provider about the best way to feed your baby if you're on Gattex. So also tell your healthcare provider about all the medications that you're taking, including any over-the-counter medications or vitamins, herbal supplements. When your absorption improves, you may improve your absorption of these medications. So your dosages may need to be adjusted. So if you're taking heart medication or seizure medication or depression medication or anxiety medication, make sure you talk to that provider as well about the fact that my absorption of this medicine might improve, so we maybe need to monitor a little more closely my drug levels. So those doses may need to be adjusted. Call your doctor for medical advice about any side effects. And you're also encouraged to report side effects to the FDA at either fda.gov/medwatch, or you can call the FDA, 1-800-FDA 1088. So one path is Takeda's patient services program. If you decide to start GATEX, this is a complimentary service provided by Takeda to help you onboard and get used to therapy and learn about the injections. It's a support program for the patient, family, caregiver to help you with access to the medication, reimbursement for the medication, and they'll help you to assess your insurance coverage, et cetera. A dedicated patient support manager and a dedicated onboarding and access specialist will work with you across the entire time of your treatment. So their function is to assist you throughout the entire process of accessing treatment, to help you navigate through insurance, and identify financial assistance options if there's a big gap there so that you don't have a lot of out-of-pocket expense. They'll coordinate medication delivery and nurse training for your nurse if she's not familiar with GATEX, if you want that. And they'll give you support, and they give the office staff of your physician support too. So if your doctor's not familiar with GATEX, there's support for them if they have any questions. So if you want to learn more about that, you can visit online, www.onepath.com. There's the phone number there. And managers are available Monday through Friday, 8:30 a.m. to 8 p.m. And then additional resources, there's gatex.com. You can learn and kind of guide you in your discussion with your doctor. There's also a Facebook page, as well as the Oley Foundation, get information, and the National Organization for Rare Disorders also can help you to learn a little bit more. So now I'm going to introduce Misa. She and I have worked together on different programs, and she's going to just tell you her story, and then we'll both be available to answer questions if you have any questions.
Thank you, Oley, for having us here today. And I want to thank Takeda also for sponsoring me to be here today. My name is Misa, as Dr. Michalek said, and I am here today to share my story with living with Crohn's disease and ileostomy and short bowel syndrome. I am a busy woman. I have never had time to be sick, not when I was young, and definitely not now. I am one of 7 children. Is this turn? Sorry. Okay. I didn't want it to be too loud. I am one of 7 children born to North African Italian immigrants. In fact, I am the middle one. My parents left Libya and immigrated to the United States to give their family all better lives. My strength, my core energy, my resilience, they all come from my family. It's really loud. My mother and father are both strong-minded and strong-willed individuals, and they always taught all of us growing up to never give up and always keep trying. Little did I know how important this life lesson was going to be as I was facing my numerous health challenges later on in life. They showed me just how strong they were when I got extremely sick right around the age of 13. I had what seemed to be like nonstop diarrhea. I spent hours on the couch, hunched over. I was in constant pain. The doctors kept telling my mother and my father that my illness was all psychological. But my mother believed me that there was something physically wrong with me. So she insisted I see a specialist, one who would finally diagnose me properly. Eventually, she found a gastroenterologist who took the time to find out that there was something physically wrong with me. An upper GI series with barium contrast and a colonoscopy showed that I had some strictures. That was when the doctor officially diagnosed me with both Crohn's disease and colitis. My doctor at the time when he diagnosed me told me that it was extremely rare to have both at the same time. But as you will see through my story, nothing in my life ever followed the usual pattern since my illness began. From the ages of 14 to 18, my illness and my symptoms were treated with multiple drugs and treatments, but none of them seemed to work. I experienced side effects, so my doctor adjusted my dosage. But the symptoms of my Crohn's disease and colitis just kept coming back. I was one of those cases that the doctor said didn't respond to typical treatments. As a teenager, I went through episodes of depression and stages of asking, why is this happening to me? Why is God punishing me? What did I do? At the age of 18, my Crohn's disease and colitis had gotten so bad that I weighed 95 pounds and I was sick all the time. I hated my life and all the pain I experienced on an everyday basis. I just wanted all the pain to stop. Some of the local doctors proposed what seemed to be like a radical solution at the time. They wanted to remove my entire colon and give me a permanent ileostomy at the age of 18. But my mother refused to believe at that time that that was my only option. So I had uncles and aunts in the Middle East who knew of doctors who had different treatments available at the time. And my parents were determined to get me to them. My mother flew me to London, where I met a wonderful doctor who performed a strictureplasty procedure to alleviate the bowel narrowing at the time in my colon and my small intestines. This was the first of more than a dozen Crohn's and colitis-related surgeries that I would have to endure. I had no idea what was in store for me. But at the age of 18, I wouldn't have listened if anybody had told me. We spent 3 weeks in London after the surgery, and then we traveled back home. I was in pain, but I was healing. Even after my first surgery, though, we still weren't able to manage my Crohn's disease and colitis. So 2 years later, we were referred to another wonderful doctor who was not in London, who years after that would be the doctor who performed my permanent ileostomy, my proctocolectomy surgery. To many 25-year-olds, this would have been awful. But to me, it was freedom. I was so looking forward to living without pain, even if it would only last me a little bit of time. And sadly, that is all it lasted. It only lasted a short bit of time. The next several years could be characterized by a sense of change. Every 2 years or so, my Crohn's disease would flare up, not respond to any treatment, and leave me back in surgery, needing another bowel resection. But that didn't stop my drive to live and thrive and succeed. I wanted to travel, so I did. I enjoyed being on the move and seeing a change in scenery. It wasn't just my health, it was my personal life as well. With my medical history, I never thought I could get married or have kids. I felt like I couldn't burden anybody with all my baggage. After I had my ileostomy surgery in 1995, I was volunteering on a horse farm for a friend of mine, and that is where I met my husband. It is so strange how life and God take you in certain directions, making you endure pain, turmoil, and suffering, but it leads you to your next journey. My husband and I dated for 5 years before marrying when I was 31 years old. I never thought at that time I could have any children due to the multiple surgeries I had already endured. A child was definitely not in my thought process. But at the age of 32, I gave birth to my daughter. And at the age of 40, I gave birth to my son. Both of my children were gifts. And even with my multiple surgeries and extremely short intestines, my body was still functioning and surviving, and I was living life. It wasn't until I was about the age of 43 that my small bowel got too short, and a surgery left me in intensive care with an enterocutaneous fistula in the front of my abdominal wall. My doctors officially diagnosed me at that time with short bowel syndrome. I was unable to absorb enough nutrients from the food I ate, and I needed to be put on parental support, also known as parental nutrition, every day for nearly 2 years. All my surgeries left me with no large intestines, no rectum, and less than 90 centimeters of small bowel. When my surgeon told me everything after the surgery, I knew I was going to have to have a strong will to survive. My body was dumping everything out into my ostomy bag as fast as I could put it in. I was so malnourished. I was in hell. I just kept repeating it to my family members. This has got to be it. Like when you reach that lowest level in your life, that's where I felt I was. My freedom and my energy, they were gone. I couldn't take care of my animals or my family at that time. I was hospitalized multiple times over the next several months. I only weighed 88 pounds. My body didn't have the ability to absorb any nutrients. My ostomy flushed and dumped everything out as fast as I could put it in. Not knowing what to do, I prayed, and then I started to fight even harder. I had to be tough, like my mom had been years ago, to get me properly diagnosed. My regular doctors knew I needed potassium and magnesium, and with some push, the doctors at the hospital consulted with my doctors, who eventually took control of my care, and under their care, my condition stabilized. When my surgeon told me about a prescription medication for adults with SBS who needed additional nutrition or fluids from intravenous IV feeding parental support, I was intrigued about it, but I was still leery. She told me about the possible serious side effects, including making abnormal cells grow faster, polyps in the colon, blockages of the bowel, swelling or blockages of the gallbladder and/or pancreas, and possible fluid overload. After doing some reading on this drug called Gattex, teduglutide, for subcutaneous injection, I wasn't ready to try it yet. Gattex is a prescription medicine used in adults with short bowel syndrome who need additional nutrition or fluids from intravenous IV feeding. Gattex is now approved for children for 1 year of age and older, but it is not known if Gattex is safe and effective in children under a year old. When she heard that there was an informational program about Gattex, she encouraged me to attend it. This time, after learning more about Gattex and speaking with my doctor, I decided it was right for me to try this new medication. While I was attending this informational program about Gattex, I looked around at all the people in the room, and I saw people who were just like me. As we talked and we shared our stories of how we got there, I was in disbelief and awe at the exact same time. They all had their own lives, they had different reasons for being here, but they were so similar to me. We all had very similar fears and concerns and worries, but we all connected in a way that I had never had that connection before since my illness started. In preparation and beginning Gattex treatment, I was contacted by a one-path patient support manager, where she helped me set up a nurse, come to my home to train and talk me through the whole process of how to prepare, how to measure my dose and give myself the injection the correct way. My one-path patient support manager and myself, my one-path patient support manager and myself has become almost like a mentor for me. My accomplishments became her accomplishments. Also, I worked with my doctor to find the right time of day to take the medicine so that it would fit into my daily schedule. We set goals and worked through any problems or side effects I was experiencing at the time. It is great to have a line of communication whenever I needed it. Prior to starting Gattex, I was receiving 2 to 3 liters of IV fluid with magnesium and potassium 7 days a week. Over time, my doctors have worked with me to get the amount of IV fluid and potassium and magnesium just right. I think we've found a good balance now. I am currently infusing 1 liter of IV fluid 3 to 4 times a week and a half a liter with magnesium twice a week. But we're always monitoring my condition, and each person's experience will be different. It has taken a few years to get my results, to get where I am now with my infusions, but my doctors and I are very pleased with my results while taking Gattex. Even still, I have experienced injection site reactions, such as redness around the injection site, bowel blockages, and an occasional nausea. I work with my doctor to manage it. This is just my experience, and everyone reacts differently to medication. My doctors are great. I have a great rapport with each of them. I think it is the strength of that solid relationship is that we communicate really well. They don't dictate to me what's going to happen. We talk openly, and they consider my opinion. We work together to figure out what works for me. It is a very one-to-one communication. I feel like I am an active part of my healthcare. I have lived with this illness for a very long time, so I do know a thing or two about it, and I believe my doctors respect that. When I was at my lowest in and out of hospital, too weak to care for my family and animals, hardly able to stand or walk, my siblings came to my rescue. As I mentioned before, I am the middle of 7 children. As siblings, we fight, we argue, but we are blood. So no matter what, we are there for each other. We're all there for me mentally, physically, and emotionally, for me and my family. They came from all over just to be there for us. They reminded me that I needed to advocate for myself. They took turns caring for my family when I couldn't. Having that support you need is so important. I am thankful to have the support from my family. While many people could see these life experiences and dwell on the negatives, I choose not to. I choose life. Living each day, experiencing new things, food, places, and meeting new people. I choose to never give up, regardless of what is happening to me at the time. And most importantly, I believe there is a purpose for everyone, and sometimes we must endure the bad and the good things that are happening in our lives. We can't see it if we don't. I believe it is my responsibility to pass along my experiences with my illness, my surgeries, and my treatments, so that others can see that you cannot close a door until you've opened it first. Thank you, everybody.
Have any questions? If you don't want to talk in front of the group, we're happy to talk with you one-on-one down in front too, so.
Hi, thank you for talks and sharing your experience. I was quickly wondering if the benefits of Gattex are maintained after injections are ceased, or is it you need to keep injecting in order to maintain that benefit?
Yeah, you do have to stay on it. Obviously, it doesn't turn around instantly because you've grown tissue. But once you take away that hormonal support, the growth is going to revert back to where it was before, eventually. It may take a few weeks.
Hi. Oh,
Hi.
has there been any study to show more effectiveness on the injection site, arm as opposed to the leg? Has there been any study to show that it's more effective one place rather than another?
No, I don't think, I don't think so. I don't think there's any difference as long as you get it under your skin. You know, obviously, if you have an area where you have edema, like swelling or, you know, an abnormal skin, you wouldn't want to inject there, but in terms of site and absorption, there's not any variability. Most people, you do their abdomen because it's less sensitive, but I have some patients who didn't like doing it on their abdomen, chose to use their legs.
And I will say, I did want to add to that. So giving my injection, it's been now 8 years. And like I always say to my husband, 8 years of giving yourself an injection, you start to kind of lose spots of where you're doing it. But on the paperwork through the GATTEX booklet, it tells you like different areas where you should follow to do it. I have used the back of my arm on each side. I've used thighs. I've used abdomen. The only difference in my case, because I've had so many multiple surgeries, they don't recommend you to do it on anywhere where there's a lot of scar tissue or you have like an incision. So definitely like follow what they recommend in the booklet for that specific, those specific things.
I have a kind of a two-part question. First question is, when you're preparing the GATTEX, you have to, I guess, like mix it and kind of do the 30 seconds and then the 2-minute wait. Is there a certain reason for that when preparing it? When you put the, I guess, the liquid in and mix it?
Oh, the mixture?
Yeah, the mixture, like why that is?
When you, okay, so when, people who aren't familiar with GATTEX, it comes as a liquid part and a powder part. So it's more stable that way. So each day when you take your dose, you need to mix the liquid into the powder. And they have you roll it to kind of mix it completely. I think the rolling versus shaking is to just avoid bubbles. And you just want to make sure that you get it completely mixed so that you don't see any particles in the liquid.
And secondly, let's say you have some other nurse or someone else injects it, and they accidentally, let's say it's 0.010, and they put 0.10, and it's maybe 10x what it's supposed to be. What are the symptoms that happen then, or what should happen after that, which I'm sure it's happened before?
I don't think there's any data on that. My own personal clinical opinion is that if it's a single dose, it's probably not going to have any major consequence. You know, if you're doing it multiple doses at that excess dose, then possibly you could possibly get more effect than you want, maybe increase risk of obstructions, et cetera. But a single dose is probably not going to be something that you need to worry about excessively.
Hi. It is any data about patient contracting cancer due to the medication?
Having cancer
Due
related to the medication? I can't speak to cases, you know, overall. It is something we worry about. I'm not personally familiar with any patients having developed cancer, but I do know of a couple physicians who have told me of patients. Both of these patients had a history of cancer prior. It wasn't bowel cancer that they developed. They had had a history. One was lymphoma, and I'm blanking on what the other one was. But so there have been some. We don't have any reports in the medical literature to really describe this, but it is something that we worry about because the medication does stimulate growth of tissue. That's why we watch for the colon polyps, and the colonoscopies need to be done a little bit more often than you would otherwise do. Now, your colonoscopy should be done based on your clinical situation. People with Crohn's disease may be getting colonoscopies already more often than the rest of the general population. So your doctor may say, I want you to have a colonoscopy every 3 years or every 2 years. So it's a decision that you need to make based on what your clinical situation is together with your doctor to keep monitoring. If anybody has any questions that they want to bring up here personally, we'll hang around for a little bit longer, okay? Thank you all.